Good morning, good morning. We're both a new caucus and a punctual caucus. You guys awake? Need some coffee? Well, I think the most important question is, before we get started, how's everybody feeling?
Good. Cold.
This ain't cold. It's chilly, but it's not cold yet. Well, good morning, everybody, and thank you all for joining us today. I want to begin by thanking, truly, Senators Tillis, Smith, and Ernst, as well as members of NAMI, the National Alliance on Mental Illness, and the American Foundation for Suicide Prevention, and all the advocates and allies that are here to share stories. Sharing stories about our life, sharing stories about our experiences with mental health, and yes, that includes struggles at times, matters. And of course, advocacy matters. And so I can't thank you enough, those of you who are strong enough to share. We're here today because both as Republicans and Democrats, we are united in this launch of a bipartisan United States Senate Mental Health Caucus. And we're here today because we know very well that somewhere out there, there's a child who is feeling anxious and alone without knowing how to ask for help. We're here today because you know that somewhere out there you may have a coworker who is struggling to reach out for help, afraid there may be consequences for asking for help. We're here because there's probably somewhere out there that you know, someone you love, who is suffering in silence and may be overwhelmed by navigating our healthcare system to find the support that they need. America has long faced mounting mental health challenges, but years of increased isolation during the COVID-19 pandemic and fear of the worst of the COVID-19 pandemic certainly made matters worse. The statistics don't lie. We know that depression rates have skyrocketed, all while we face significant mental health workforce shortages. And it's taking a toll. Suicide is now the second leading cause of death in children ages 10 to 14. And I know that many of us here today are parents. Angela and I are trying to raise three gentlemen of our own. And it's up to us, all of us, to expand the conversation, to make conversation about mental health normal, and to tackle this crisis head on. So for all the harm of the last several years, the pandemic has put a spotlight on mental health awareness. People are beginning to realize the scale of this problem and the wall of stigma that prevents too many from getting help is beginning to come down. We often make the comparison that when someone hurts or even breaks an arm or a leg, nobody judges you for going to the doctor to seek professional help. People are coming to understand and appreciate that when it comes to mental health, we need to treat it the same way. We have a chance to capitalize on this moment and find and advance bipartisan solutions. And so that's why today we are indeed proud to announce the formation of this bipartisan Senate Mental Health Caucus, where we will bring together members from both parties. We will work to share resources, to improve quality of care, and to expand the mental health workforce. And we know that progress is possible because we've seen progress. We've seen the passage of the Bipartisan Safer Communities Act, a historic step forward in children's mental health. But our work didn't stop the day that President Biden signed it into law. We have work to do to make sure the funding is implemented thoughtfully, strategically, effectively, and quickly. Congress also created the 988 crisis hotline, but far too many across the country are still unaware of this life-saving resource. And so that's why we're creating a forum to end the stigma around mental health and to share our stories, because everyone has a story. I found my way into mental health advocacy through my wife Angela, whose mom, my mother-in-law, suffers from bipolar 1 with schizoaffective disorder, a pretty significant condition. But it's been so inspiring because in addition to the struggles I've heard from Angela and her family and friends of rallying around my mother-in-law to offer the support that she needs while navigating insurance, navigating hospitals, navigating doctors, we know that with such a significant condition, my mother-in-law is thriving, and if there's hope for her, there's hope for everyone. So by creating this forum, we do have a chance to create a coalition that touches the lives of not just our friends and family, but of every American. And maybe there's a story that's shared that will break down the stigma for a parent in California, maybe that of someone like Senator Ernst who can better reach veterans, a singer or an artist who can more effectively reach teenagers than senators can, or a professional athlete who can inspire a college student. The point is that every news story is a crack in the wall of stigma, and each story makes it easier for the next and the next and the next. And one by one, we will all finally feel comfortable treating mental health exactly the way we treat physical health. We have a lot of work to do, and I'm so excited. I'm now proud to introduce our next speaker. Please welcome to the podium my co-chair from North Carolina, Senator Tom Tillis.
Thank you, Senator Padilla, Senator Smith. I want to thank NAMI and the American Foundation for Suicide Prevention for also being here. I thanked them earlier for being here, but I thank them in advance for all the work they'll do. I mean, when you start a caucus, a lot of people wonder, what does that mean? It means that we need to increase the focus on something that's critically important for the American people, but also it's important for members of Congress to understand so that we can take additional positive steps and in the right direction. We have to really get everyone to understand, it's a statistic that's oftentimes stated, but I think seldom internalized, that 1 in 5 people experience behavioral health problems, which I'm looking at a group of 40 people here. 8 of us have, statistically speaking, experienced behavioral health problems. I'm one of them. Back when I was diagnosed with a disease back in 2007, there was a drug regimen that you could use to beat my disease into remission. It then caused me to have pharmacologically induced mania for about 2 or 3 months, followed by just profound depression for about 6 to 8 weeks, while I was coping, working in a job and raising a family. That was a blessing to me, though, because it gave me insights into so much work that we have to do. Loved ones who need to be better educated on caregiving for people who are in a crisis, people who are ideating suicide. What can we do to get them to someone, to get them to a place where that they can find comfort and recover? So this conference, or this caucus, is about educating our members, finding more that we can do, but also being very clear that there's more to do just by implementing the Bipartisan Safer Communities Act. That is one of the most significant pieces of legislation in terms of funding for access to behavioral health in the history of this country. And it's going to be a game changer if we work with state and local governments to make sure it's implemented right and implemented with the intent that those of us who worked on the bill and got the bill passed had in mind. So again, Alex, or Senator Padilla, I want to thank you for your leadership. I look forward to being a part of this caucus, but not just a member who shows up every once in a while, but somebody who's going to roll up their sleeves and continue to get a lot of good work done. And I'll turn it back over to Alex.
Thank you, Tom. Our next speaker is someone who I believe really did the country a service in speaking of her own experiences from the floor of the Senate a few years back. Please welcome Senator from Minnesota, Tina Smith.
Thank you so much, Senator Padilla. Thank you, Alex, and thank you, Senator Tillis. And I want to also, in absentia, thank Senator Ernst, who also joins us in this Caucus and was unable to be with us this morning. And many, many thanks to NAMI and to the American Foundation for Suicide Prevention as well for being with us. So mental health care is health care, and it should be available to everyone who needs it, no matter where you live or how old you are or what kind of insurance that you have. And when I struggled with depression, first when I was in college and then when I was a young mom, I was really blessed to have not only the family support, but also the access to health care that I needed so that I was able to get the medications and the therapy that I needed to heal. And that should be true for every single person in this country. Yet we know that it is far from true for everyone in this country. You know, I made the decision to share my own story about my challenges with mental health because I wanted to break down some of the stigma that we've been talking about, some of the barriers that cause people to be fearful that if they tell their story or if they ask for help, that people are going to see them as weak and not strong for asking for the help that they need, which is why I always say that asking for help is a sign of strength and not of weakness. We are doing good work to destigmatize mental health by establishing this bipartisan caucus, and we have to continue our work to make sure that mental health resources are available to everyone. And I'm really proud of the work that we have done in Congress to take a strong step going down that road. Thanks to the work that we've done, the bipartisan legislation that we've passed, schools in Minnesota and around the country are able to hire mental health professionals that they weren't able to hire before we passed the legislation that we did. Seniors on Medicare are able to have access to a wider array of mental health care practitioners because of what we've done. And the federal government has more tools to make sure that insurance companies and employers can be held accountable if they are not providing a full range of mental health care services that they should provide based on the law. In Minnesota, I've talked to so many parents that are distraught because they can't find an inpatient bed for their child who needs it for a week or two. Somebody who is very sick and can't find access to the health care that they need. But I've also seen great success stories as people are able to access telemental health, living in rural communities so that they can get the care that they need. I know that we know what to do to break down the stigma that too many people experience and to expand access to care. And for me, today's launch of this bipartisan mental health caucus is another very positive step down the road of addressing this deep need that so many Americans face. You know, mental health care is not a red state issue or a blue state issue. It is something that we all see in all of our districts. So I'm grateful to my colleagues for working together to be able to continue to make progress. Thanks so much, Alex.
Thank you, Senator Smith. And of course, ask any member of the Senate, they'll tell you that the good work that we're able to get done certainly doesn't happen by us alone. We have tremendous partners and allies in coming up with ideas and finding solutions and implementing them. Here to speak on behalf of the National Alliance for Mental Illness, please welcome Mr. Daniel Gillison.
Thank you. So this is a very exciting day and a long day in the making, and it wouldn't happen without the leadership of the senators that are here with us today. So in my comments, what I want to say is to Senators Padilla, Tillis, and Smith, thank you for your leadership in forming the Bipartisan Senate Mental Health Caucus. There's an old proverb that says, if you want to go fast, go alone. If you want to go far, go together. The establishment of the Bipartisan Senate Mental Health Caucus is a perfect example of how we can go further together. As true leaders do, you are working to bring everyone together to tackle an issue that affects every American family. As we heard earlier, 1 out of 5 people will have a mental health condition at any given time. 1 out of 2 of us will be impacted by a mental health condition at some point in our life, directly or within our family. Whether it is you, someone in your family, a friend or colleague, we are all impacted. Too often our friends and loved ones go on this journey alone. On average, there is an 11-year delay between when a person first starts to experience symptoms and when someone seeks help. This unconscionable delay in care would not be allowed for any physical ailment, and we must not allow it for mental health. This is our opportunity, and we must do better. Thanks to the leaders standing next to me, anyone who is struggling with their mental health will know that they are not alone. This caucus will not only work to advance policy solutions, but it will send a loud, clear message. Mental health is the bipartisan issue of our time, and that when we all work together, Democrats, Republicans, and Independents, we go so much further than we could go alone. On behalf of every person affected by mental health conditions, thank you to Senators Padilla, Tillis, Smith, and Ernst for your leadership, your tone, and your execution. We look forward to working with you in the Senate Mental Health Caucus.
Thank you, Daniel. No, before bringing up Laurel Stein, I just want to share that a few years ago when I was learning particularly about suicide and suicide rates in America, one of the statistics that was shocking me into action was to not just see what was going on with our young people, but what was going on in the public safety community. When there are more officers who die by suicide than in the line of duty on an annual basis, it speaks to a crisis. When there are more firefighters who die by suicide than in the line of duty each and every year, it speaks to the crisis. These are first responders that we all revere, that we honor for their courage and bravery and service. And they just serve as examples that we're all in this together. Here to speak on behalf of AFSFP, please welcome Ms. Laurel Stein.
Good morning. I'm Laurel Stein, the Executive Vice President and Chief Policy Officer at the American Foundation for Suicide Prevention, the nation's largest nonprofit organization dedicated to saving lives and bringing hope to those affected by suicide. I stand here today to stress the state of our nation's mental health demands bipartisan attention across and at all levels of government to address the ongoing and unprecedented mental health crisis. I repeat, the state of our nation's mental health demands bipartisan attention across and at all levels of government to address the ongoing and unprecedented crisis. Suicide is the 11th leading cause of death, and Senator Padilla notably said the second leading cause of death for children 10 to 14. It is a serious and preventable public health issue, with 12.3 million adults having serious thoughts of suicide, 1.7 million attempting suicide, and over 48,000 individuals having died by suicide in 2021. We know that 90% of people who die by suicide have a diagnosable and potentially treatable mental health condition, and that mental health is an important component and one of many factors that contribute to preventing suicide. So as our attention focuses on the rising rates of suicide, to the sounding of the alarms in light of these concerning statistics, it is clear mental health must be prioritized. And the increased national dialogue about mental health must be amplified to help address our nation's challenges of stigma and access to mental health care. AFSP applauds Senators Padilla, Tillis, Ernst, and Smith for elevating the importance of mental health through this pivotal launch of the Bipartisan Senate Mental Health Caucus. The caucus will serve as a critical way to effectively address the challenges we face today by building upon past bipartisan congressional accomplishments, such as the designation of the 988 Suicide and Crisis Lifeline and enactment of the Bipartisan Safer Communities Act with its significant investments in mental health. And the caucus is well positioned to build on the momentum to address youth mental health, workforce, crisis response, and increase access to mental health care. AFSP stands ready to work with the caucus to improve mental health and save lives. At AFSP, we say often that we all have a role to play in suicide prevention. And today, I add, we all can help make mental health the priority it deserves. Thank you.
Thank you, Laurel. Now, before we open up to questions, just two final comments. One, we've recognized Senator Tony Ernst for being the other co-chair or co-founder of this caucus. So it is truly bipartisan. In fact, there are 10 caucus members to date and growing. It includes not just myself, Senator Tillis, Senator Ernst, and Senator Smith, but also Senator Fetterman, Senator Moore Capito, Senator Booker, Senator Collins, Senator Klobuchar, and Senator Murkowski. 5 Democrats, 5 Republicans, truly bipartisan and growing. We have a lot of work to do. We're excited. We know time is of the essence, and we thank you all for joining us this morning. At this point, we'll open up to any questions you may have.
Do you have any first priorities for this caucus? Any pieces of legislation you're going to do right out the gate?
Well, we're I think the first two that we're beginning to wrap our minds around are, as we mentioned before, the implementation of the Safer Communities Act. It has some good policy. It has historic investments in mental health in that. So we want to make sure that we implement that well and build on success. The other that we're beginning to think about deeply is workforce. You know, for all that we've done in recent years to elevate awareness, overcome stigma, encourage people to seek help, it'd be cruel to suggest that people seek help and that help not be available to them on a timely basis. So we need to have that longer term strategy for more psychologists, more psychiatrists, more therapists, more counselors, more of the workforce in all areas to support mental health. But I'll invite Senator Tillis and Senator Smith to add anything.
The only thing I want to emphasize, and I'm going to beat this drum probably for as long as the job's not complete. We really have to get everyone to understand what a foundation the Safer Communities Act is for behavioral health and mental health access. It's creating a pipeline for schools to have counselors. It's creating a pipeline for family courts and drug courts and veterans courts to receive additional resources that they need. But most importantly, it's creating greater access to unserved and underserved communities. So this is one where we may find that we need to work on it, that it's a good baseline, but getting feedback from state and local governments on what more we can do to facilitate its implementation is critically important. So part of it may be new legislation, but some of it may just be tuning existing policies that maybe were good at the time but need to be modernized and amplified so that we can just provide a bigger, a wider range of options for people who are seeking behavioral health.
Senator, there's been some concerns that the Safer Communities Act hasn't been implemented as fast as in some states as some would like, including the Education Secretary. Is there a communication problem?
It's a communications problem. Look, the Safer Communities Act was implemented in 5 states about 5 years ago. It took about 5 or 6 years for them to start to be fully implemented, right? And the Safer Communities Act is even further reaching than that. It's not only the pilots that were implemented in some states that had great effects, they were very successful, but it goes beyond that. That's what we're talking about: school hardening, school counseling, drug courts, and family courts. A lot of those are separate. They're in addition to that baseline of Safer Communities Act. But every state, every member of Congress has a role to play to go back into their states, as I've done, and pound the table to say, we need a task force focused on execution. It's got to involve the legislature. It's got to involve the governors, the executive administration in every state. It's got to involve each local education unit, every one of the administrators, so that they understand how to implement this in tandem. That's when it's going to produce the greatest result.
Any other questions?
When it comes to growing the caucus, all of you have spoken about your own mental health connections, whether it's yourself or a loved one. What's your pitch to other members of the Senate who maybe don't understand what it's like to experience a mental health crisis, to have a loved one experience it, and why your efforts are so important?
Yeah. In my outreach and conversations, honestly, I haven't come across a member who doesn't get it. Whether it's 1 in 5, I've heard 1 in 4. The point is, if you yourself haven't had an experience, odds are somebody you know has. And it could be a family member, it could be a friend, it could be a coworker, it could be a neighbor. But we've all had the experience. Sometimes you just haven't realized it yet. So that hasn't been the issue. I mean, I think some offices have a policy of not signing up to be a part of a caucus or staff workload. Like, I think we're getting there. We're at 10 today. I have no doubt that we'll be at a much bigger number as time goes on. But we're anxious to get to work. So we're launching and we're going. All right. If there's nothing else, thank you all for being here.
Thank you.